everyone, welcome back again. I am Dr. Ushna from the AMC Smart Prep platform. Today we are going to discuss a topic that is a very important topic for your exam. If you are preparing for your FCPS, MLE, PLAB or even AMC, this is the topic that is extremely important for your exam and it's must to come topic. And many students find it as a nightmare, or even I struggled so much during my exam preparation. So let's crack it down, make the things easy for you guys. And I have break down the easiest way to master all the murmurs. So you have to be updated with this video and watch till end. So this is basically just a basic structure, basic introduction of your heart anatomy. We will not go into so much details. We do not have to focus on the unnecessary information that is not required for your exam. Just be particular what is required for your exam. So we have heart right atrium. This is your right atrium. Then you have your right ventricle and your left atrium and your left ventricle. This is basically your right side of the heart and this is your left side of the heart. So your right side of the heart is receiving deoxygenated blood, which is shown by the blue color. So deoxygenated blood, this is blue color, is present in your right side of the heart, and oxygenated blood is present on the left side of the heart from the superior vena cava, inferior vena cava into the right atrium, right ventricle, enters into your lungs, and from the lungs through the pulmonary veins enter into left atrium and left ventricle. This is a very basic step, you all know. So if you dissect the things further, these are the valves which are very important in if you read the anatomy of the heart. On your right side we have two valves. One is known as pulmonary valve, which is tricuspid. Three cusps are present in the tricuspid valve. And we have tricuspid valve. Again, this is three cusps are present. Three small cusps are present on the right sided valve. So these are your valves of your right side. Then we have left sided valve like aortic valve and your mitral valve. So only the mitral valve, see, it has two cusps. Small two cusps are there, small flaps are there, and this is present on your left side of the heart. So you should remember this picture, because whatever murmurs we are going to learn, it's based upon the location of the that particular valve of the heart. So you should be very focused on what are the right side, what are the left sided valves. Then further discussing what is the concept of diastole and what is the concept of systole. Remember, just you do not need to remember whole of your cycle, that is not required for your exam. Just remember, when the heart gets filled, it's receiving all the blood through the superior vena cava, through the inferior vena cava into the heart, right atrium through right ventricle. When it's pooling of blood in the heart, this is known as diastole, okay, filling. When the heart pumps the blood to the body backward and then there is a shrinkage of the heart, this is known as systole. This concept is important because some murmurs have relation with the diastole, some murmurs have the relation with the systole. So this is just a basic concept. Now we are particularly discussing on the discussion of murmur. So you have to be very particular what are the areas you have to auscultate for the auscultation of the murmur. Let's say you have aortic area, pulmonary area, tricuspid area, and the mitral area. These are the four areas which are very important. You can ignore this one, bicuspid area. So we have four different orders of areas that are important with particular location in the body. Very easy mnemonic to remember the areas are: all pigs try to make bacon. Okay, so all pigs, remember, all aortic area, side by side pulmonary area, then below is a tricuspid area, and you have mitral area. All pigs try to uh, uh, make bacon. So aortic area and your pulmonary area, remember, these are two areas which are side by side on your second intercostal space. Same location, second intercostal space. On the right side is the aortic area, on the left side you have pulmonary area. Then you have these areas which are tricuspid and mitral area, both are present on your left side, okay, not the right side, left side. So tricuspid area is left lower sternal border, just remember this, left lower sternal border, and your mitral area is basically a far away mid fifth intercostal space, mid clavicular line. Okay, so these are areas which you have to remember, because if you remember these areas, it's very easy to understand that which kind of murmur you are having with that particular area. You can correlate easily. So just a small line: all pigs try to make bacon. Okay, so these are area. Make a visual memory of this picture. Now we are going to summarize the murmurs so easily, so easily. Don't skip this video. Watch till end. Then after end of this session, you are going to be a master of the murmurs. Trust me. So the first concept is diastolic murmur. Remember diastole, filling of the heart when the heart is pulled with the blood. So what are the murmurs that you are having in your diastole? Remember the mnemonic arms. Do not need to remember so fancy information, so much detail. Just be particular for your exam oriented information. Remember mnemonic arms. Okay, so in diastolic murmur we have list of four category murmurs, but among four exam oriented, two murmurs are important, just two: aortic regurgitation and mitral stenosis. These two are important for your exam, otherwise both other two are not important. Second important concept is that in arms you have aortic regurgitation, AR, and you have mitral stenosis, which I told you are the most important murmurs. So you are master of these diastolic murmur by remembering these arms. Okay, just remember this picture with the heart. Arms is your diastolic murmur. Now remember, our aortic and pulmonary area, they love to be together. Okay, and your mitral and tricuspid area, they love to be together. So all the murmur, whatever you are learning, this was the basic murmur, aortic regurgitation. You do not need to mix the murmurs with the other things. So aortic regurgitation, he loves to pair with the pulmonary regurgitation, and your mitral stenosis loves to pair with the tricuspid stenosis. If you remember this arms, you can correlate with other murmurs as well. Okay, so aortic regurgitation, mitral stenosis, this is your diastolic murmur. That's it. Okay, two murmurs done. Now systolic murmur. You can have a concept that all the murmurs, all the remaining murmurs are basically systolic murmur. So if you are able to remember the arms, whatever is left is your systolic murmur, which is basically Mr. S. Mr. S is your systolic. So Mr. is for mitral regurgitation. He loves to pair with the tricuspid. So mitral and tricuspid regurgitation is your systolic murmur, and AS is your aortic stenosis. Okay, aortic stenosis. A for aortic, S for stenosis. And he loves to pair with the pulmonary portion. So aortic stenosis, pulmonary stenosis, both are systolic murmur. So just remember the important one for exam. Other is coming side by side. You remember mitral regurgitation and aortic stenosis. Forget about the other one. Okay. So mitral regurgitation, aortic stenosis. Mr. S. Mr. S is your systolic. Arms is your diastolic. Just two words, and the murmurs are so easy to remember. Now, the next important thing, forget about all the information. I'm not going to tell you right now, otherwise, you are going to get confused. At the end, we will come back to this slide and you will be able to tell me what are the changes with particular murmur. So, moving on, remember this important concept in question. Sometimes they mention some particular murmur is increasing with respiration, some particular murmur is decreasing with respiration. So it's easy to remember by a simple word. You make the word inspiration towards respiration, okay, and expiration to l'expiration. Okay, so all the right sided murmur that are going to increase with the inspiration, and all the left sided murmur that are going to increase with the expiration. Easy peasy, very easy to remember. So respiration and l'expiration concept. Now the same thing, what are the right sided murmurs? So you have to remember this picture. Right sided murmurs were basically your tricuspid and pulmonary murmurs, and your left sided murmur was your aortic and mitral murmur. So you have to remember, you have to have this orientation of the location of the murmurs. So all the right sided murmurs that are going to increase with inspiration, and all the left sided murmur are going to increase with the expiration. That's it. What is the pathophysiology behind why the murmurs are increasing? These are not important for your exam. Trust me, AMC do not ask pathophysiology or anatomy of any topic. You need to be very particular in your preparation, that you have to focus on the things that are required for your exam, not the cluttered information, because the syllabus is so vast, there are so much to cover. If you try to keep on remembering every pathophysiology, every anatomy, you are going to mess with yourself. Okay, so do not focus on the things that are not required. Then this slide is a cheat slide, you can say. You have to remember this slide as such, because some particular maneuvers like Valsalva maneuver and Handgrip maneuver, they act as a clue towards reaching the diagnosis. Very importantly, what is very important is HOCM, hypertrophic obstructive cardiomyopathy. The murmur increase with the Valsalva when there is a built up pressure in your air. that is going to be increased, and it decrease when the hand grip. So mostly they give you some clue in question with for reaching towards this murmur. So remember, Valsalva maneuver decreases the preload, that is filling of the heart. So all the murmurs that increase with your Valsalva maneuver are this one, outflow murmurs, and that decrease with the hand grip are this one. Okay, so you have to remember this slide as such. This is not related to today's lecture, so I'm not going into so much detail of what is Hawcom and what is not. Hawcom we will cover in the different session. So just skip this slide if you want to. Next, we are going specifically for certain murmur that are extremely important for your exam. So first one is aortic stenosis. Remember stenosis. We have aortic valve that is basically connecting the aorta to the left ventricle, and that has become narrow, obstructed. Heart is not happy. It's so hard to pump the blood from the left ventricle to the whole of the body. So there is aortic stenosis. If I show you just a slide, that this is a slide of aortic stenosis, you will not be able to remember. At the end of lecture, you will say what I have just taught, I am not able to reproduce. So we will not go into the fancy slides. We will go in a shortcuts, mnemonics, that how you are going to remember the things, aortic stenosis. So remember, aortic stenosis, we have an Uncle Calc. Just remember Uncle Calc. This Uncle Calc is going to make your life so easy to remember the aortic stenosis. Now, whatever the MCQs are going to come, you are going to crack it so easily. So Uncle Calc, he loves to eat carrots, and after eating carrots, he feel energetic and he loves to climb that hill for the trekking. So just remember this picture as a memory for the aortic stenosis. This Uncle Calc picture. So what is the breakdown of this mnemonic? First of all, calc means you have very high chances of having aortic stenosis in elderly patient, age-related patient. Why? Because your aortic valve become calcified. Calcification is present in your age-related patient. So calcified aortic valve, that is causing left ventricle obstruction, and other important causes congenital. Okay, so Uncle Calc is calcified aortic valve, elderly patient, and if it comes in the younger patient, the very important cause is the bicuspid aortic valve. So you have two important causes of aortic stenosis. One is the bicuspid aortic valve if the younger patient is mentioned, and one is the calcific aortic valve if your older patient is mentioned. Why Uncle Calc loves to eat carrot? Because the murmur is going to radiate towards your carotids. Okay, so easy to remember. Carotid murmur radiation that is present with your old age patient, that is aortic stenosis. Now, what is the type of murmur and what is the location of murmur? So type of murmur, remember, he loves to go up the hill and down. So murmur is going to start at an increase in intensity, reach its maximum, and it's going to come back to its original state. This murmur is known as crescendo, decrescendo, upward, downward, upward, downward. So crescendo, decrescendo, ejection, systolic murmur is your aortic stenosis. Because we know this is a systolic murmur, your Mr. as aortic stenosis is a systolic murmur. So this is a systolic murmur. But what kind of systolic murmur? Now you are able to identify crescendo, decrescendo murmur. Where you are going to auscultate this? Remember our area that was basically right second intercostal space. Okay, so right second intercostal space, you are able to hear ejection systolic murmur, which is crescendo, decrescendo, that is causing the problem to the carotids, radiating to the carotids. So this is your aortic stenosis. By remembering this Uncle Calc, eating the carrots and climbing the hills, your aortic stenosis is done. Perfectly done. Now the next thing is that what is mitral regurgitation? Okay, mitral regurgitation. Just remember, mitral regurgitation is this little boy who has the name Mitral. This is a mitral baby. So mitral, he is carrying a hollow pipe in the axilla. Okay, so remember this picture, that kid who is mitral and he has basically rheumatic heart disease. He's suffering from the rheumatic heart disease, though he is happy, and he is carrying a hollow pipe in the axilla. So what you are going to have, due to that rheumatic heart disease, the patient is presenting with a shortness of breath, fatigue, palpitations can be there, any features of left heart failure can be there. So this murmur is a hollow systolic murmur, because we know we have basically mitral regurgitation murmur that is presenting as the hollow systolic murmur. that is radiating to your axilla. Okay, so any murmur that is radiating to axilla, remember mitral regurgitation. That is very important murmur. So just remembering these things: mitral baby, association with rheumatic heart disease, murmur radiating to axilla, you are done with the mitral regurgitation. So what is the actual location of your mitral valve? Remember, where was the mitral valve? That was present in your this fifth intercostal space. Remember the location of the your murmur that is present in your fifth intercostal space. That was your mitral area. So you are going to auscultate the heart of this baby. You are going to have mid axillary line, fifth intercostal space, a harsh hollow systolic murmur that is going to radiate towards axilla. That means this is a baby of mitral regurgitation. That's it. Okay, easy peasy. Next, remember I told you this M pairs with the T. So mitral regurgitation always pairs with the TR. So you can remember this mitral baby is carrying this hollow pipe to beat this junkie. Okay, this junkie is going to tease that baby and he is carrying the hollow pipe to beat that junkie. So tricuspid regurgitation, which is again a holosystolic murmur, because these two are paired together. These two are very important murmurs to be together. So mitral regurgitation, which was a holosystolic murmur, is basically paired with the tricuspid regurgitation, which is also a holosystolic murmur. So what's the difference between the two? First of all, the location is different. This holosystolic murmur do not radiate to axilla, do not radiate. This junkie is basically so, you can say, in a drunk position that he has built a tourniquet and everything is blocked. The murmur is not going to able to radiate to any other side. You will be able to hear the murmur in an actual tricuspid area. So what was the tricuspid area? That was your left lower sternal border. Okay, that's why you have to remember the location of the murmurs. That is very important. That is not very tricky. So you try to remember this once or twice. That is becoming so easy. So tricuspid regurgitation, that is most common in the IV drug abusers. Remember this junkie murmur is not radiating to anywhere. It is audible in the left lower sternal border, which is basically holosystolic murmur. So that is your easiest way to remember tricuspid regurgitation. Now, next important thing is mitral stenosis. This is again a very important murmur. So, what is mitral stenosis? Remember, mitral stenosis, just remember a line: opening system on the Microsoft window. Okay, so Microsoft window, he is opening. This valve is so narrow and it's trying to open the Microsoft window. Why we have learned this mnemonic, opening system in Microsoft? So remember, in mitral stenosis, Microsoft, you have opening snap. This sound is very particular for your mitral stenosis. Whenever you read this word opening snap, this is your mitral stenosis until proven otherwise. Okay, so opening snap, this is very important feature of your mitral stenosis. Then you know what is the location of mitral valve, which is fifth intercostal space, mid clavicular line. So this there you will be able to hear the murmur. What is the kind of murmur? Remember, arms, your arms mnemonic. So aortic regurgitation and mitral stenosis, that was your diastolic murmur. So this is not a systolic category, that is your diastolic murmur. So you are going to have this diastolic murmur, which is a low pitch because it takes time for the Microsoft to open. So you are going to have low pitch diastolic murmur, you are going to have opening snap, you are going to have murmur at the apex fifth intercostal space that increase with exercise when he boost up. So this murmur, which is tired, mitral stenosis, so narrowed, he's trying to open the system in the Microsoft. This is basically your mitral stenosis murmur. Now, this is again the same representation that the Microsoft system that is opening, basically opening snap, and you are going to have fifth intercostal space, you are going to have opening snap, mid diastolic rumbling murmur. The word rumbling is used for this identification. This is also very important. Mid diastolic rumbling murmur, that is very particular for your mitral stenosis. And with mitral stenosis, one very important association is atrial fibrillation. They give you clue in the question that the patient is going to have atrial fibrillation, and after atrial fibrillation you are able to hear a murmur in the fifth intercostal space, that is mid diastolic rumbling murmur with the opening snap. So your diagnosis is going to be mitral stenosis clearly. Then you have this again repetition, because that becomes so difficult to remember with us just a one view. So these are the areas. If you are able to remember these areas, whatever the murmurs they are giving you, just have to correlate the things together. Mr. Carrot uncle, Mr. Calc uncle, that was aortic stenosis. That mitral baby who was rheumatic heart disease carrying a hollow pipe towards the axilla was your mitral regurgitation. Along with the mitral regurgitation, that junkie that was beaten up by the hollow pipe, that was your tricuspid regurgitation, whose murmur was not radiating to anywhere, that was in the left lower sternal border. Along with that, you had this Microsoft Office that was trying to open by the mitral stenosis. So these are very easiest way, the most easiest way to crack the murmur, which I find very useful for myself. So I have shared this video for you guys. If you want to go into detailed preparation of the AMC, particularly based on the mnemonics and the tricks to remember the topic so easily according to the updated guidelines oriented for your exam, I have my channel which is AMC Smart Prep. This is the Telegram group and the WhatsApp group links. I will put the links in the description box also, and this is the QR code you can scan to join the WhatsApp group. So we have a paid session for the AMC Smart Prep. I cover whole of the theory in about 2 months, and along with the theory you will be provided complimentary past paper of 1 month, that is solved past paper with the updated guidelines also. So if you want any further query regarding the preparation of your AMC, or you want to cover specific topic, you want me to cover specific topic for your AMC, just comment in the comment section. I will reach out to you. Thank you so much.